Diastasis. There's a good chance you've never heard that word before, but here's what should stop you cold. Right now, as you're watching this, you might be living with it and have no idea. And here's the part that really gets people. Most folks are absolutely convinced this is a women's problem, something that only happens after having a baby. Wrong. Dead wrong. Men get it. Children get it. Women who have never once been pregnant get it. And if anyone has ever told you that the one and only way to fix it is to go under the knife with general anesthesia, I need you to stop scrolling and listen to me very carefully, because that single piece of advice could turn into the most expensive and damaging mistake you will ever make with your own body. I'm Dr. Ryan Foster, and across 15 years of working directly with patients, I've lost count of how many people I've watched get pushed into operations they never needed in the first place. Nobody is going to sit you down at your next appointment and explain what I'm about to explain to you. Why? Because the system makes its money when you stay sick and dependent, not when you quietly fix yourself at home for free. So do me a favor right now, subscribe and hit that like button if you want the honest, unfiltered version. Help Dr. Foster reach 10,000 subscribers. Let's get into it. Let me tell you what diastasis actually is. The full name is diastasis recti, and all it really means is that your abdominal muscles have pulled apart. Picture the front of your belly for a second. You've got two long straps of muscle running straight down the middle, one on the left and one on the right. Most people know them as the six-pack muscles. And running right down the center, joining those two straps together, is a band of tough tissue called the linea alba, which is simply Latin for the white line. Now pay attention here. That white line is not muscle. It's connective tissue, the exact same material your ligaments and your tendons are made from. Its entire job in life is to hold those two muscle straps clamped tightly together in the center of your body. Here's the key part. That white line is wrapped inside broad sheets of connective tissue called fascia. Think of fascia as a wide, flat covering that surrounds each of your muscles, front and back, and right in the middle of your belly, all of those sheets fuse together into one single strong seam. That seam is what keeps your entire belly wall firm, tight, and closed. But when that seam is weak, when the tissue is loose and slack instead of tight and springy, then the moment pressure builds inside you, it starts to spread apart. The two muscle straps drift away from each other, and a gap opens up right down the middle of your stomach. So what tears that white line apart in the first place? By far the single biggest cause is pregnancy. Over 9 long months, the womb grows and grows and grows, slowly stretching every single tissue in the belly, and the white line right along with it. Now, if a woman's connective tissue was strong, elastic, and springy to begin with, then once the baby arrives and the womb shrinks back down, the muscles pull themselves back in, the white line gradually tightens up, and the gap closes on its own. But if that tissue was slack and weak from the start, it simply stays stretched out. It never springs back. The separation can be small or it can be huge. 2 centimeters, which is a little under an inch, or 3, 4, 5, even 8 centimeters, which is more than 3 inches wide. Let me be crystal clear on one thing before we go further. A small separation just above the belly button, roughly an inch after childbirth, is completely normal. Honestly, it's often nothing more than a sign that a woman has given birth at some point in her life. That's not something you need to fix. That's just biology doing its job. Now I have to warn you about the 2 enormous mistakes people make with diastasis. The first mistake is trying to fix it with completely the wrong exercises. If you have diastasis, you must never ever do movements that lift your torso off the ground or lift your legs off the ground. Here's exactly why. When you lie flat on your back and raise your upper body or lift your legs, your belly instantly bulges outward and the pressure inside your abdomen shoots straight up. Then as you keep pulling your rib cage toward your hips, you're pushing your internal organs down even harder, and that pressure climbs higher and higher still. Every single time that happens, the white line gets stretched further apart and the gap grows wider. So the classic sit-up, the classic crunch, the very move that everyone on earth believes gives you a flat stomach, is precisely the move that makes diastasis dramatically worse. With this condition, those exercises are off the table, completely. Don't do them. The second mistake is rushing headfirst into surgery. When a woman has a noticeable separation, say 4, 5, or 8 centimeters, she's almost always offered an operation to stitch it shut. Most of the time, it's done through a keyhole procedure with tiny punctures. They go in, sew the muscles back together, and sometimes add a mesh to reinforce the whole thing. From the outside, it all looks fine. It holds. It sounds like the problem is handled and gone. But surgeons themselves have a saying, and they mean every word of it. The best operation is the one you never had, and here's my honest position, backed by exactly what I've watched happen with my own patients over the years. In the overwhelming majority of cases, almost every single time, diastasis can be closed without any surgery at all. And it doesn't demand some heroic, exhausting effort either. Just think about it for a moment. On one side of the scale, you do a handful of targeted exercises, you strengthen your connective tissue, you take a couple of supplements, you fill in a nutrient gap or two. On the other side of that same scale, you throw yourself into the full weight of surgical risk. You take general anesthesia, which is always a genuine shock to the body. Anesthesia is chemically switching your brain off, and it can interfere with your memory and your mood for a long time afterward. And every operation, without exception, leaves scar tissue behind, and scar tissue pulls and tightens the body toward itself for years to come. So the way I see it, you owe it to yourself to make every reasonable effort to dodge the knife first. And the honest truth is, the effort involved just isn't that big. Here's the bonus on top of it all. Everything you do to close that gap also makes you healthier overall, not just in your belly. So let's completely reframe the goal here. When we set out to close diastasis, what we're truly doing is strengthening connective tissue across your entire body. And I want you to follow this chain of logic carefully, because you can trace it without a single lab test. If you have diastasis, then you have weak connective tissue. If you have weak connective tissue, then you very likely have a condition called connective tissue dysplasia, which simply means your body builds this tissue too loosely everywhere. And that condition usually walks hand in hand with low vitamin D and shortages of key minerals, the exact raw materials your body needs to manufacture strong tissue in the first place. Now the ideal path is to actually get your blood work done and sit down with a doctor who reads your results and starts closing those gaps one by one. As your tissue grows stronger everywhere, every exercise you perform closes the diastasis faster. And here's something you absolutely have to understand. When your connective tissue is weak, it's basically impossible for that weakness to sit in one single spot on your belly. It shows up everywhere. That's exactly why weak connective tissue travels around with a whole crowd of other problems. Varicose veins, those swollen ropey veins in your legs, hemorrhoids, organs that sag downward inside you, stretch marks across the belly, the thighs, the back, anywhere at all. A heart valve issue called mitral valve prolapse, where one of the heart's valves is too floppy and doesn't close tightly. Bad nearsightedness, trouble with your teeth, your nails, your hair, joints that crack and bend far too far, all of it traces straight back to the same loose, weak tissue. And if you've had some chronic illness nagging away at you for more than a year, that's a loud, clear signal that your metabolism and your connective tissue are begging for attention. So when you spot diastasis, you can now see it's really telling you something far bigger about yourself. You start fixing the whole system, not just the belly, and in a strange, almost beautiful way, you can genuinely thank that gap in your stomach. It pointed you straight toward the real problem while there was still plenty of time to fix it. And closing it makes your entire body stronger, which means a longer, healthier, sharper life ahead of you. Now let's talk prevention. We've established that diastasis appears most often in women after childbirth, and we've agreed it isn't really the pregnancy itself doing the damage, it's the weak connective tissue lying underneath. Still, to stop diastasis from ever forming or from getting worse, here's what I'd tell every single woman after giving birth. Wear a support band for the first 2 months, and then wear supportive firming garments from 2 months all the way to 6 months. Here's the reasoning behind it. The very moment the womb empties out, the space inside the belly suddenly shrinks. But muscles that spent 9 full months stretching simply cannot snap back into place in a single second. They stay stretched out, and in that critical window, they need help. An outside support takes some of the load off them and gives them time to slowly, gently draw themselves back together. Before I hand you the exercise, let me say something important about age, because it matters here far more than most people realize. After the age of 40, your body produces new collagen much more slowly, and collagen is the protein that gives connective tissue all of its strength. That means the exact same gap closes faster in a younger body and demands more patience in an older one. So do me a favor, drop your age down in the comments below. I genuinely want to see which age group most of you fall into, because it changes how quickly you should expect results and how I'll shape the next videos I make for you. Now let me give you the single best exercise I know for diastasis, and understand this, I only ever teach things I've personally tested on myself. The logic couldn't possibly be simpler. If you want a flat, pulled-in stomach, then pull your stomach in. That's it. That is the entire idea, start to finish, and here's precisely how you do it. Pull your belly in as far as it will possibly go. Pull your belly button back toward your spine and hold it right there. Don't let it out. Now, keeping that stomach pulled in tight, you start pulling even harder, in short, sharp pulses, trying to suck the belly button in deeper and deeper. You can breathe out in little short breaths between the pulses, but in those tiny pauses, you never once let the belly relax. How long do you keep going? You go until your body flat out tells you, I can't do any more, until the muscles start to fail and cramp on you. And then, very slowly, you release the tension. Even if you do it just one single time, at the intensity I'm describing, you'll feel your stomach tighten and pull inward a little right away. Here's how it works on the gap itself. Those two muscle straps that drifted apart, with a little window sitting between them, get firmer and tighter as you train them this way. They start pulling back toward the middle, and bit by bit, they close that window shut. I've personally seen women who were already scheduled for surgery with a gap of 7 or 8 centimeters, more than 3 inches, do this one exercise for a single month and discover the separation had shrunk so dramatically that surgery was taken completely off the table. Do this exercise at least once every single day. Honestly, I'd tell absolutely everyone to do it, whether you have diastasis or not, because every one of us needs a strong lower belly, a solid foundation for the entire body. And the real beauty of it is that you don't need any special position at all. You can do it lying down, sitting up, standing tall, and you can even do it while you're out walking. That right there is what makes it so incredibly valuable to me. It asks for nothing from you. No mat, no equipment, no privacy whatsoever. When you're out for a walk and you suddenly remember it, you just start pulling that belly in, and you're doing your body an enormous favor. If your diastasis is large and obvious, then do it 3 or 4 times a day, 3 or 4 sets each and every time, always going until the muscles begin to cramp. That's the point where you get the fast, visible results. And I'll tell you straight, I've watched this happen again and again and again. No matter how many times you've given birth, whether it's 1 child or 5 children, you can absolutely get your stomach into excellent shape. It comes right down to the correct exercises and the right effort put in, and this is the main one that gets you all the way there. Tell me down in the comments exactly how you feel the moment right after you try it. So here's your takeaway, straight from me as your doctor. If you have a gap, stop the crunches and the sit-ups today, right now. They are making it worse with every single rep. Start the draw-in exercise once a day, and more often if the gap is large. Get your vitamin D and your minerals properly checked, and treat that gap as a message about your whole body, not just some cosmetic flaw you're stuck with. Do all of that, and in the vast majority of cases, you will never ever need an operation. One last thing before you go. Your own doctor almost certainly won't sit you down and walk you through any of this, and the reason is simple. There's no money in a patient who fixes herself at home for free. I'm telling you anyway, because that is the exact reason this channel exists in the first place. So subscribe, leave a like, and help Dr. Foster grow all the way to 10,000 subscribers. We're building something genuinely real here, together.